Hi, I'm Dr. Mike Carragher. I'm Medical Director at The Body Well, and today I'm going to show you how to do an intramuscular injection. We typically use these for testosterone injections, and as far as supplies go, we've got our vial of testosterone here. This is what we call a multi-dose vial, okay? So you get multiple injections out of one vial. We have our syringe and needle that we're going to inject with. We have a blunter needle that we're going to draw up the medication with before we inject it, and we have an alcohol swab to clean the area of injection, okay? So the first thing we're going to want to do is uncap our testosterone vial, set that aside, take our alcohol swab, and just clean the top of the vial to keep things nice and sanitary, okay? You open up just like a Band-Aid your syringe and needle that you're going to inject with, okay? But first we need to draw up the medication. So you're going to want to twist this needle tip off and set that aside for just a moment, okay? And then you take your blunt needle tip and you're going to peel apart that. Screw your syringe into the needle tip, okay, like that. Then we're going to expose this needle. That's a big needle. You're not going to want to inject that into your muscle. That will hurt a lot. So you're going to uncap your medication, and you're going to take your needle tip and put it into our rubber stopper here and draw up our medication. In most instances, this is 1 cc, so you're going to go up to the 1 mark. Your dose may be different though, maybe half a cc and maybe 0.6 cc's, but you're going to draw up to wherever your prescribed amount is. Just like that. Then you're going to want to pull that needle tip out. You're going to want to recap that needle very carefully. And now we're going to screw back on the needle tip that we're going to actually inject with. Like so, okay? That's a much smaller, shorter needle tip, and that's what we're going to inject with. So now we're ready to do our injection. So as far as doing an intramuscular injection, the best place to do that is in the gluteal muscle, or basically in the butt cheek. And so you're going to want to grab the outer upper portion of the butt cheek. So that's about here, okay? You're going to want to avoid the hip bone over here, okay? You're going to want to avoid the sciatic nerve here. But really in any fleshy part of the butt cheek, you can do the injection, okay? And the way I like to do it is uncap the needle, okay? And you're just going to hold it like this and dart it right into the muscle and use your thumb to press the plunger down to inject the medication, okay? And then you can pull that out and you're finished. It's really easy. The trick here is to just dart it right in quickly, okay? If you press the needle in slowly, it's going to hurt more, okay? So now that our injection's done, we're going to want to dispose of this needle in our sharps container, okay, as well as the needle tip that we drew up the medication with. You should have been provided with a sharps container when you got your medication. If not, you can pick one up in a pharmacy. Do not throw these in the garbage. Make sure that they're put in a sharps container to dispose of them, okay? For more information on hormonal optimization or age management or anything else that we do, please visit our website at thebodywellusa.com or call the office at 323-874-9355 and speak to one of our team members. Thanks.